Hi, my name is Bruce and I'm with 573 Medicine, and today we're going to be talking about the abdominal aorta and the inferior vena cava. The abdominal aorta and the inferior vena cava are retroperitoneal structures that deal with blood supply to your viscera and to your lower extremities. The abdominal aorta is going to pass through the aortic hiatus, through the diaphragm, and into your abdominal region, and will have several different branch points as seen in this image. The branch points will either be anterior, lateral, or posterior lateral. Your posterior lateral ones are not visualized well in these images, but what they do is they will branch off and provide blood supply to the posterior wall of the abdomen and to the muscles of the back. And these are going to be your lumbar arteries, and they're going to be pairs, and there's going to be about 4 of them in the lumbar region of the body. Your anterior ones are actually going to be singular structures that will branch off from the very front of the aorta. And then your lateral ones will usually branch off into pairs and will provide viscera with blood supply. The aorta's first anterior split point is going to be the inferior phrenic artery, followed immediately by the celiac trunk, which will provide blood supply to a lot of the superior viscera like your liver and your stomach. Then you'll have your superior mesenteric artery, which will be providing blood to the more proximal portions of the intestines. You'll then have your left and right renal artery, which are going to be the first paired arteries that we'll see, and these are going to be providing blood to the kidneys. You'll have your inferior mesenteric artery, and that's going to be providing your distal intestines. And then you'll have your left and right ovarian or testicular arteries, depending upon your donor. And these will go all the way down into the pelvis and provide those organs with blood supply. At this point in time, the aorta will kind of continue down until it starts to enter the pelvic inlet. And when it does, it will then bifurcate at the aortic bifurcation into your right and left common iliac arteries. And then each one of these will split. And at that splitting point, one of the vessels will start to course posteriorly, and that's going to be your right and left internal iliac artery. And then the other part of it will start to branch more anteriorly, and that's going to be your right and left external iliac artery. Now, the renal and suprarenal blood supply are interesting, mostly because it's going to give us some information about the anatomical relationships between the inferior vena cava and the abdomen, and the abdominal aorta. The abdominal aorta is going to be usually on the left side of the spine, and then parallel to it is going to be the inferior vena cava. And what this means is that any of the veins that are coming from the lateral left side are going to have to be longer than the ones that are going to be going towards the lateral right side, because they're going to have to cross over the abdominal aorta, as seen in the renal vein here and here. So your right renal vein is much shorter than your left renal vein. Additionally, the same things can be said for the abdominal aorta and its branching points if they're going to be on the lateral sides. So your left renal artery is going to be just a little bit shorter than your right renal artery. Now, getting blood supply to your suprarenal glands actually comes from 3 different points. So the celiac trunk will end up providing branches that will be your superior suprarenal arteries. Then there's going to be another branching point just off of the abdominal aorta, right next to the renal arteries. It's going to be providing the middle suprarenal arteries. And then off of the renal artery, you will have your inferior suprarenal arteries. So the blood supply to the adrenal glands are from 3 different locations. However, the blood will then drain off into your suprarenal veins on either side, and those are singular structures. On the left suprarenal vein, it actually drains directly into the renal vein, and then that renal vein will drain into the inferior vena cava. However, on the right side of the body, the right suprarenal vein will drain directly into the IVC. Finally, looking at the inferior vena cava, let's just work backwards from what we did with the aorta. So your internal and external iliac veins will then come together to form your right and left common iliac veins. The right and left common iliac veins will then come together at the inferior vena cava commissure, and then you will start to ascend Then the right ovarian or testicular vein will drain directly into the inferior vena cava here. However, the left ovarian and testicular vein will actually go all the way up to the left renal vein. You'll have your right and left renal veins that will drain into the inferior vena cava. And the inferior vena cava will also receive veins from the liver and things like that. But then it will eventually drain all the way up into the right atrium. If you like this video, please like, comment, and subscribe, and email us anytime at realtalkmeded@gmail.com for any comments, questions, or concerns. And thanks, and have a great one.